Hello friends, welcome to the channel Dewdear Academy. So in this video I am discussing the questions from the exam conducted for the Junior Health Inspector exam by the Department of Health Service, and the question is, what is the route of administration of BCG vaccine? Options are intravenous, subcutaneous, intradermal and intramuscular. So what is the route of administration of BCG vaccine? So first option is intravenous. So this route involves injecting the substances directly into the veins. So this is not suitable for BCG vaccine because BCG vaccine is designed to act locally within the skin layers and it stimulates a localized immune response. So the first option, intravenous, is wrong. Then subcutaneous. Option B is subcutaneous. So this route involves injecting the substances beneath the skin into the subcutaneous tissue. So the BCG vaccine is not administered subcutaneously because it could affect its efficacy and also safety. So this is not administered subcutaneously. So that is also not the correct answer. Then we have intradermal, the option ID, intradermal. So this route involves injecting the substances into the dermis, the layer just beneath the outer skin layer, epidermis. So this is the injections which are we are injecting the substances directly into the dermis, which is below the epidermis. So this BCG vaccine is specifically designed for intradermal administration to ensure the proper immune response and to avoid any complications. So option C, intradermal, is the correct answer here. And we have the last option, intramuscular. This route involves injecting the substances into the muscles. So this is commonly used for vaccines like the tetanus or influenza vaccine, but it is inappropriate for BCG vaccine. Intramuscular is mainly in case of tetanus or influenza vaccine. So the intradermal is the correct answer because BCG vaccine we are usually administering intradermally, mainly on the left upper arm, to ensure effective stimulation of the immune system and also it avoid deeper tissue complications. So this is administered intradermally and the correct answer is option C. Then the next question, under the National Vitamin A Prophylaxis Program, vitamin A prophylaxis is given to. Options are option A, every 6 months up to the age of 5 years, every 6 months up to the age of 3 years, only at 9 months of age, at 9 months and at 18 months. So according to the National Vitamin A Prophylaxis Program, vitamin A prophylaxis is given to children. So at what age is it given? That is the question. So first option is every 6 months up to the age of 5 years. So according to the National Vitamin A Prophylaxis Program in India, the first dose of vitamin A, that is 2 lakh international unit, is given at 9 months of age. It is given at, first dose is given at 9 months of age, along with the measles vaccination. The first dose is given. Subsequently, the doses are administered every 6 months. Up to the age of 5 years. So first dose at 9 months, then it comes every 6 months up to the age of 5 years. So this help prevent vitamin A deficiency and also any associated conditions like xerophthalmia and night blindness in children. So according to this National Vitamin A Prophylaxis Program, vitamin A is given the first dose is given at 9 months of age and then it is given every 6 months up to the age of 5 years. So here option A is the correct answer. Option A is the correct answer here, and the other all options are wrong. At every 6 months up to the age of 3 years is wrong, and it is given only at 9 months of age, that is wrong because only the first dose is given at 9 months along with the measles. along with the measles. The first dose is given at 9 months. Then at 9 months and at 18 months of age is also the wrong answer. So the correct answer is option A, every 6 months up to the age of 5 years. Then the third question, amount of available chlorine in freshly prepared bleaching powder is? Options 33%, 40%, 25% and 53%. So what is the amount of available chlorine in freshly prepared bleaching powder? So the correct answer is option A, that is 33%. 33% is the correct answer here. The freshly prepared bleaching powder, which is also known as calcium hypochlorite. Calcium hypochlorite. So this is the freshly prepared bleaching powder. It contains approximately 33% available chlorine by weight. So this is the amount of chlorine that can be released when the bleaching powder is getting reacted with water. So when the bleaching powder reacts with water, the amount of chlorine that can be released is that is the 33%. So this chlorine is the active agent in the powder responsible for bleaching and also for disinfecting. So this chlorine is the active agent here, and the correct answer is 33%. 40% means the bleaching powder typically contains less than 40% chlorine, while some chemical formulations or compositions might show slight different values. So 40% is higher than the standard 33% found in freshly prepared bleaching powder. So that is not the correct answer. And 25% is also not correct, and 53% is also incorrect. So amount of available chlorine in freshly prepared bleaching powder is 33%. So thank you all of you. Thank you for watching this video.